Good evening, everyone. A very good evening, everyone. I hope you all are staying safe and cozy in this warm winter night in Melbourne. I'm Chris Malika Bhadra, and I welcome all of you to another conversation on Chai Chat and Community by Word Palette. Tonight, I'll be speaking about miscarriages and the impact it has on a woman's mental health. To know more on this topic, I have with me Dr. Beulah Joseph and Dr. Swaroopini Thangarajah, as you can all already see on the screen. But before I get to them, to kind of get introduced to them to all of you, I would like to begin by acknowledging the traditional owners and custodians of the land on which we are meeting tonight, the people of the Kulin Nation. I also pay my respect to the elders, past, present, and emerging. On that note, we already have a comment, ladies. So before I get to introduce you guys, I'll just quickly wish a very good evening to Noreen. Noreen, thank you for watching, and a good evening to you too. Please stay with us. It's a very important conversation. All right. So Swaroopini and Beulah, first of all, thank you so much for joining us tonight. How are you doing, first of all?
Well, thank
nice
you.
And toasty. I think we've been living with the heaters on for a while now.
Swaroopini, how are you doing?
I'm going fine, thank you. Yes, it's been nice weather in Melbourne today, so it's been lovely.
Yes, awesome. So, all right, Beulah, I'll start with you first. Why don't you tell us a bit about yourself, and then Swaroopini, I'll come to you.
So my name is Beulah Joseph. I'm a psychologist and have been for, I think maybe about 10, 15 years. I've worked in all sorts of different types of roles and at the moment focusing on therapy for individuals over the age of 18. So mental health is my passion, of course. Well-being, how can we be more proactive in looking after ourselves and checking in on our mental health? So, how can we sort of reduce the stigma around talking and thinking about mental health? So
Absolutely.
Those are the things that I'm really passionate about. That's the sort of work that I've been doing.
Thank you, Beulah. Thank you so much for joining us tonight. And then we have with us Dr. Swaroopini Thangarajah. Swaroopini, tell us a bit about yourself.
Hi, so I'm Swaroopini. I'm a GP obstetrician. So I've been a doctor for about 12 years now and been working with the public health services doing pregnancy clinics. So and I also work in GP practices and teach at the universities as well. So I have a real passion for women's and children's health. So women's health, especially from before pregnancy to the getting pregnant, including, unfortunately, the miscarriages that happen as well, and then the pregnancy care and after pregnancy care too. So I also help out with some cesarean sections and some operations for gynecology too. So I love to do lots of things to help women's advocacy as well, because I think we don't often take good care of ourselves. We love to take care of our nurturing roles for other people, our other family members, friends as well, but we don't often do things for ourselves. So I like to make sure that we as women are encouraged to take care of ourselves, not just from the mental health perspective, but also from a physical health as well.
Yeah. True. So needless to say, ladies and gentlemen, I have with me two powerhouses, two ladies who are like absolute dynamite. So I'll just dive deep into the conversation. So Swaroopini, I'd like to start with you. As I mentioned, we are discussing about miscarriages. It should never happen to anyone, but it does. And the various impacts it has on mental health of women, right? But first things first, how common are miscarriages? Like, is there a reason why we are told to be very careful in our first and our last trimesters?
Yes, so I think before we start talking about this this topic, I think it's very important that we acknowledge, I will go through obviously how common they are, but knowing the number of women that will be listening, and not just the women, there might be other family members and other men as well listening to these podcasts too. So I think it's very important that we acknowledge that everyone that we're probably is our audience would have had experience for themselves personally having miscarriage, or having had known someone in their friends or family circle. So it's very important that we are aware that it can be a very emotional topic tonight when we're talking about it. And also, if you need to take a break or you want to ask us private comments later, just make sure you take time for yourself, because it's something that not everyone is able to understand, I think, until you've gone through it yourself. And only you know how you can take care of yourself. So this can be a very triggering topic today. But in saying that, it's also something that we do need to talk about, because I think it's often a topic that we just put under the covers and don't really bring out to the forefront. And I think I'll go through how common it is, but then we all will realize that we probably do know someone that's gone through it. So that already shows how common the miscarriages can be as well.
Absolutely.
So I think with regards to percentages, it's generally quoted about for sort of all age groups, if we're going to start from about sort of the age of 12 onwards till about the age of 45, the risk as a general is about 1 in 5. So it's very common. So there's 3 of us already here talking. So if we had another 2 women, one of us would have a miscarriage if we were trying to have children. So that's very, very common. So I think we need to be aware that it's not just something that just happens to a very few people. It's very, very common. So I think if we want to go through ages, the 12 to 19-year-olds will have about a 13% miscarriage rate. For, if we're just talking about general health is the same for everyone. But then if we go to like the 30 to 35-year-olds, we're talking about the 15% mark. But then after we get past 40, it jumps to about 50%. So, 35 to 39 is about 25%. So one in 4. But then after the age of 40, yes, we do get to 50%. So it's quite a sudden jump, just for a couple of years difference. So that's something that we do need to be mindful for, that we cannot change our age when we're at a stage in life that we're ready to have children. So everyone has their own career aspirations or their own family obligations or their own financial obligations before they can think about having children. So I think it's, we can't say, oh, this is the age you have to get pregnant. It's nothing like that. Everyone has their own unique situation. So we're not comparing anyone and saying, oh, you need to have children by this age. But we need to also be aware that the women's body, we do have extra risks as the body does age for pregnancy, not just for miscarriage, but also other pregnancy conditions too. So we're talking very common. 1 in 5 is the general general rate. And if we talk about the number of women that, even if I've delivered women or had their, helping them through their pregnancies, many of them have had a miscarriage, but then also had a successful pregnancy too, that resulted in a child. So it's also important to think about the outcomes that can be possible also. So it's not always that, okay, if someone has a miscarriage, the next pregnancy will always end up in a miscarriage. No, it's not like that. So I think it's important that we also try to see some positive in having something terrible happen to a woman. And I think miscarriage is one of the worst things that can happen to anybody in their life. So I think it's something that's so traumatic on an emotional sense, but also on a physical sense. When we'll talk a bit later about this, about how miscarriages are managed, but I think that's also traumatic in itself, because it's not just having one thing, it's actually then managing it and then trying to then deal with that situation and moving on to hopefully a better outlook. And if you're trying to have another child, for us to help with that as well. So I would say there's absolutely really great services with people like Dr. Beulah as well, because I think mental health is so important. So to seek out help, even if you've had a miscarriage or 2 or 3, very important to seek help with a professional also, because sometimes your friends and family, yes, they can help talk to you a little bit, but I think sometimes you need professional help. It's just like if we have, the roof leaking, the plumbing, generally we're not going to fix that ourselves. We're going to go to the professional. So similarly with our mental health, it's sometimes really good to debrief with a medical professional like a doctor, and also the psychologist as well. And if needed, the psychiatric doctors as well, because altogether as a team, we can really optimize things to help you debrief a situation and also manage it well without putting it on someone that doesn't know in your family or friend circle, because sometimes they don't know how to respond. And we might take that negatively, like, oh, that friend doesn't want to help us, or they don't want to hear our problems, but actually they just don't know what to do. So that's why the professionals are there. So I think it's very important that we acknowledge that there are so many people there to help women. And if you do need help, just ask, and there will be someone that can point you in the right direction.
Absolutely. So maybe another question before we move on to Beulah and some comments. Is there a specific reason why ladies are told to be very, very careful in their first and the final trimester during their term?
Generally, the first 8 to 12 weeks is where all the organs of the fetus is starting to form. So all the things like the brain and the heart and all the developmental parts of the body. So generally, we really do try to ask women to stay clear of alcohol and smoking cigarettes, and also other drugs as well. So, cannabis, cocaine, marijuana. So all of those things, because they do have a direct impact on cells and the tissues that are going to form this fetus to be healthy. So they have an absolute proven relationship to causing harm to the baby's outlook as well, and also to the mother's health as well. Then caffeine is also another thing, but generally most, I don't think, there's going to be a majority of women that are having 3 to 5 drinks of like very strong coffee a day every day. But that is another risk factor that sometimes women may not be aware of as well, as an issue, because obviously we love our tea and coffee generally, and it's one of those things where I think we can be mindful in those first 12 weeks too. And I'll also say that it's a good chance for anyone that's trying to think of having a baby, also go and see your GP or general family doctor, because sometimes there's things that can be optimized before you get pregnant, and there's some vitamins we'd like you to take to help prevent some abnormalities that could happen in the pregnancy as well.
Now that's very useful information. I'll quickly hop onto some comments. So that's my mother dearest, and she says very important topic. So thanks, Ma, for watching as always, and thank you for being there. And for all our listeners and audience, we have popped in some really important link. We have popped in Dr. Thangarajah's and Dr. Joseph's personal contacts. So if you need any help, please feel free to reach out to them. They'll be more than happy to speak with you. On that note, Beulah, I'll come to you now. So speaking from a mental health perspective, Beulah, what is the impact of miscarriage on somebody's mental health?
I think it's huge. Miscarriages are often things that are unexpected and are unwanted. And so when something like that happens, it can be a real shock for the individual, but also for the family members. I think primarily, there's a lot of grief, as there would be with any death. However, we're talking about a child, and in a lot of cases, the parents are longing for this child, are waiting for this child, and something goes wrong. And so it can be a huge weight, and it can feel quite overwhelming. It can mean that getting out of bed, seems pointless. There can be a lot of sadness, a lot of anger and frustration, a lot of resentment. And that's just for the individual. The people around the individual, the woman, they're also struggling with this, because babies are often a joyous celebration of life, and people look forward to it in a lot of cases. Um, the thing to consider as well is that grief is not just about death. And that's why we often talk about it as being grief and loss, because we can grieve for the loss of a pathway or an opportunity. So part of the grief that someone might be experiencing when there's been a miscarriage is not just the death, but it's also the loss of the opportunity to be a mother. It's that loss of the family unit that people were looking forward to. And it can be quite overwhelming to process. And also, in addition to that, when there's been a miscarriage, the body takes a little bit of time to heal from that and to get used to the fact that the body is not pregnant. So you're talking about a whole bunch of hormones going around as well, in addition to the emotional reaction to what's happened. And so that's why I second what was said before. It's really important to get the right supports in place. And there are lots of people who are more than happy to offer a helping hand. And again, sometimes family and friends are well-meaning, are supportive, but they might also be dealing with their own grief. And it can be really helpful to have a separate space and time where you can actually talk through what's happening for you. And women often forget to do that. We often write down the bottom of our priority list, and we support other people and look after other people and do everything for other people. But then when we need that space and time, when we need that support, we forget about it. And so that's why people like me are here to actually support someone in that healing and recovery process, which can take a while. I often get asked, how long is this going to take? How long before I'm fixed? How long before I'm fine? It's not that anyone is broken when you go through an experience like this. It's just that it's a very hard experience to go through. And there's no set time for when you finish grieving. It's very individual, and it depends on a whole bunch of other things that are going around does the woman have supports in place from family and friends? Do they have the right medical care? Can they access that? What's their socioeconomic status? Do they have those kinds of resources available? Is there any kind of other physical or mental health condition that they're also grappling with? So it can be quite a complicated um, situation for a woman to have to navigate. And sometimes, too,
Absolutely.
when we've experienced such a tragic thing, it's not just our own grief that we're trying to work through, it's also managing the emotions of people around you. And depending on the ability of the people around you to be able to process and to manage their own emotions, that can have quite a heavy,
Take a
strong
while. Yeah.
impact on the woman going through the healing from the miscarriage as well. Um,
Absolutely.
the other thing, too, to keep in mind is there can be a lot of shame and a lot of blame involved. As a woman, it's not uncommon to feel, well, what did I do wrong? What have
Yeah.
I done to lead to this miscarriage? And sometimes, unfortunately, the people around might say those same things. And they might be talking out of anger or out of their own grief. But again, that doesn't become a very healthy situation for the woman or the family to be able to heal and recover from. So, miscarriages can be quite challenging experiences. And that's why I second what was said before. Um, it's not it's not a failure to reach out to ask for help. It's actually the most effective way of being able to process through things at a healthy rate. The more we avoid and push away and ignore the emotions, the emotional challenges that we might be experiencing, the bigger they get. So it's almost like, when you try and push something down over time, it just builds and builds and builds
Yep.
until it explodes.
Just,
So what we want to do is to start to address things as they
yeah.
happen.
Absolutely, Beulah. Just before I move on to Swaroopini, just a quick question, and let me know if I'm completely off track. In your experience, have you ever seen someone who's unfortunately had a miscarriage and gone into depression because of it? Have you ever seen someone go through depression because of that? Oh, okay.
Yes, I
Yes,
think it's a very common because especially at the time there's hormones involved, as Dr. Beulah said. So with the hormonal shifts, also after any pregnancy related event, even if it's a successful pregnancy, depression is very, very common, unfortunately, even after a successful pregnancy. So you can imagine the increased stress and anxiety that can be there with a miscarriage on top of those pregnancy hormones as well. So very common, and I think that, as Dr. Beulah was saying, the blame that someone could place on themselves, or I find that a lot of women ask, obviously, why, and then they go through almost every day of those last few weeks, and they think, oh, I did this on that day, that must have caused this to happen. And then we, as medical professionals, we are there to tell them that's, if that's not the case, that miscarriages are very common, as we can see, and the most common cause is something that there's no cause for. It's a chromosomal abnormality. That's just a thing that happens at the time of the embryo starting to form, and generally that miscarriage is because it would not be compatible with life. So it's the body's way of actually helping to not have something major abnormal happen to the child if it was to be born, because it wouldn't be successful to be able to live. So that's the body's way of having a miscarriage. So I think it's really important that we understand that a miscarriage is actually generally, we don't actually find causes for them, because they're just something that happen at almost the chromosomal level, and we cannot change, we cannot prevent it, we cannot make that happen to somebody. So that's why, I think if we think about, we think about, okay, if we had the ideal person that had a normal weight and height, had a low risk ethnicity for miscarriages, then had, no diabetes, no blood pressure issues, no other medical conditions, and they ate perfectly well and they'd exercised really well, they could still have the similar risks of miscarriage, regardless of other factors. Then other factors increase risk for some women, but the innate risk of a miscarriage is just so common, and we find that that's what the main thing we explain to women is that there was in the majority of cases we could not have found a cause, and hence we cannot then say don't do this the next time to prevent it for the next time, because we didn't actually find out what the reason was for the first miscarriage. So I think it's very important that women understand, and that's why seeing the professionals actually will help, because I think the general population may not have all that knowledge to know that it's not their fault as women to have a miscarriage. So I think to know that, that it's not their fault, there's nothing they did. So I think it's very important that we understand that, because that also helps people to get to the next level of then when they are ready, or if they are ready to then have another successful pregnancy, that they have a very clear mental health mindset to then be, have less stress and anxiety, which will be helpful for that next pregnancy. So I think it's very important that we do address those people that have depression that does come out of a miscarriage, but also the general baseline depression rate, which is also very common with or without people having miscarriages. So even, that's what we've got to make sure we, actually breach through that subject of that stigma around mental health generally in our Southeast Asian and South Asian communities, which is very high. It's just one of those, no, we don't talk about this in our family, and it's very much brushed under the table in a lot of the communities. So that first we have to, understand that there are professionals out there to help and assist. So that's where I think the biggest message is to utilize what's available, because that's generally when we see better outcomes for people that seek out help. And it's not easy to seek out help. It's one of the hardest things to do, is to go and talk to almost a complete stranger. Hopefully you all have your own general doctors and your own, support systems, but so many don't, obviously, at our age. So I think having those people in place to help is really, really important to seek out, because they will just help you on the journey. And I see a comment that's just come through that, of course, the father's mental health is primarily another very important thing, and again another overlooked topic, because we always focus on the woman because of the physical changes that happen. But that's when we realize that, any pregnancy is a full family unit. So it's absolutely the father of the fetus, but also siblings of that fetus too, because there's younger children that were aware that, a new baby was going to come, and then suddenly the parents are stuck with the topic of saying, how do we deal with the baby is not coming, and how do you explain that to a young child who does not understand about a miscarriage? So it's a whole family that gets affected, like Dr. Beulah said. So I think that's where we generally need to lean on professionals for these sort of things, because it's just such a traumatic thing that anyone has to go through. So I think getting the right supports is the way that we can optimize. And sometimes we do need medications also to help to get through the hormonal shifts that depression is caused by as well. So I think that's where, people like Dr. Beulah, myself, and psychiatrists, we're aware that there are chemical shifts that require treatment in an effective way. So I think that's where to seek the professional help is very, very useful.
Yep. And thanks, Maha, for watching. Swaroopini, you've covered the risk factor of miscarriages pretty well, but I just want to quickly touch base with you. How do you manage a miscarriage if it has occurred? How do you manage that?
Yes, so there are a few different types of miscarriages, because it depends on, we talk about if the cervix has been opened or closed. So if we imagine if a baby is coming through the cervix, it's going to be 10 centimeters for a head to come through that cervix. So generally, people that are not pregnant, the cervix is closed. Depending on if someone has had bleeding or pain during their early stages of the pregnancy, can change, because some women will actually present to emergency departments when we see them, and they're miscarriaging because of heavy bleeding at the time, and then we have to, at that moment in time, intervene. So sometimes it's medications, but sometimes if the bleeding is quite heavy, then it's actually surgery as well. It's a minor surgery, but it requires general anesthetic. Quite a routine type of surgery, but it is there because we need to then remove the parts inside the uterus that could cause infection or could cause even more hemorrhaging, because miscarriages, like pregnancy, can affect mothers in terms of bleeding very heavily with hemorrhaging, and can cause death for mothers too. So we need to be aware that, bleeding and pregnancy, and we have very good healthcare services in Australia. But as Dr. Beulah pointed out, even in rural and remote regions of Australia, access to healthcare could be 10 hours away. So that, it still is similar to our countries back home, where not everyone is going to have access to the hospitals there and then within 20 minutes from their house. So we need to be aware that, the mortality and the death rates of pregnancy-related things around the world are actually quite high. We just don't see it in countries where we live, but we're able to prevent that. So I think if you are miscarrying and you think that the bleeding is quite heavy, then please go to the emergency department or call the ambulance. But if it's just a little bit of spotting and there's a little bit of pain and most of it you can manage to get an appointment the next day with the doctor, then that can be done too, because sometimes we definitely usually get a scan to find out what's happening, an ultrasound, and then we'd talk with the women about what options they have. Because sometimes we can actually give options. Sometimes there can be a wait and see approach in some cases where we can wait up to 2 or 3 weeks to see if the body will pass everything naturally. Sometimes we can give medications to help as well, but sometimes in some cases we need to give surgery as well to be able to have the best outcomes for the mother as well. So it's a real case-by-case basis. So I think that's also where the stigma sometimes lies, because some women will say, oh, I didn't have to have surgery. Why are you having surgery? And then the person having surgery again feels like they've had a failure because they didn't have to have a surgery, where another woman didn't. So I think we need to be aware that these situations are very case by case. And that's where the professionals are there to give you the advice. And if there are options, we'll absolutely offer them to you. For us, people think that we always want to do surgeries, but actually we don't. We'd much prefer not to have to do surgeries. It's much easier to talk to someone or give some medications rather than do a surgery. That's a procedure. So we're not always out to do the most interventional sort of type of procedure. We really want to give choice as much as we can. So I often say that it's a case-by-case basis. It depends on how many weeks you are, what type of miscarriage it is, what are your other medical conditions, and are there risks to surgeries, or some people are not having reasons we can't give medications. So there's a lot of differences, but there are 3 main options, which is the wait and see, depending for some people, the medications, and then the surgery. So ideally, we do want to make sure medical care is involved, because if women stay alone at home and then they have too much bleeding, then yes, it can be quite disastrous, but also infections can happen, and then things can be unfortunately left behind, and then that could affect next pregnancies too. So we do want to make sure that you're seeking the right help so that we can guide you to hopefully the outcome that you want to getting if you do the next child, that we help to optimize that as much as we can as well.
It's very, very useful information, Swaroopini, but I'm sure people listening and women listening to you will have a lot of insight by all that you and Dr. Beulah are mentioning. But Beulah, I'll come to you now based on what Maha also mentioned. We mostly talk about women's mental health, but also the partners are affected. On that note, how do you provide emotional support to someone? For example, your partner unfortunately has a miscarriage. How do you manage to give emotional support to your partner and also look out for yourself on that basis? How do you do that?
I think it's very important, wherever possible, to have open communication about what you need and what the other person needs. So I think it comes down to the communication within that relationship. So it can be very individual. Emotional reactions, I might react in one way, someone might react in a different way. So being able to articulate, this is where I'm at, even if it's, I don't know what's going to help, it's still an important communication to have with your partner. And also for the father to be able to have some space for himself to be able to grieve and process, because the woman would be going through a lot of physical stuff as well, to be able to sort of heal and recover in that way, and the emotional stuff as well. So it's important within a relationship to ensure that you're carving out a little bit of time for yourself to be able to process what you are experiencing, to be able to identify, okay, this is what's going on for me, and to be able to then go, what do I think I might need to help me heal from this? And in a relationship, once you have that level of self awareness, to be able to communicate it to the other partner. So both of you have your cards on the table and you can heal and recover from the experience together. I see a lot of relationships where people are bunkering down with their pain and suffering, and isolating themselves and not communicating. That's just going to exacerbate any tensions or existing conflict, and it's going to make things worse. So that's where it's really important to be able to build up your level of self-awareness, even if it's sometimes saying, I'm not quite sure what's going on, I don't know what's going to help. Let's try this and see what happens. Sometimes, too, when someone is really overwhelmed with so much emotion and lots of intense emotion as well,
Yeah.
pare it down to the basics, your basic self care. A little bit of water, a little bit of food, a little bit of rest, a little bit of movement, and some social connection. Even if it's just putting a hand on a shoulder for 2 seconds, that is still a useful thing to do. Sometimes, when someone is overwhelmed with the amount of emotion that they're experiencing, a little bit of touch can actually help ground them, pull them back into their body rather than getting
Yep.
lost in their thoughts. So, very, very small, simple things. It's not any complicated strategy. You don't have to add one strategy on top of another strategy. That's too much. Pare it right down. So it's just the basics. And again, that communication becomes important. And when you're talking about a family with children in there, it's not just letting them know what's happened, it's also about them seeing the parents grieving. Kids are
Yeah.
very smart. They soak up everything, they pick up on everything. So some communication to them is important, to let them know, I'm struggling with this right now, but these are the things that we're going to do so that we're all healing and recovering from it. Depending on the age of the child, you can give a little bit
Yeah.
more or a little less information, but it's still important to let them know this is what's going on. And it's going to take me a little time to recover from this.
But Beulah, this is like a common family setting, right? Partners or partners with kids. I want to talk about a single mother. She's a single woman. She's having a hard time. She doesn't have a partner. Is it difficult, more difficult for single mothers to cope up with it? Or what has your experience been in this factor for single women who've miscarried?
It depends. So if a single woman has other supports around her,
Yeah.
um, then that person stands a better chance of being able to recover well. If that person is on their own, and doesn't have the social supports or the professional supports around them, they're going to struggle a lot more. And that's where we see deterioration of symptoms, and it's almost pure survival to be able to get through that, and things might not be dealt with. So certainly that's where the community can come in, the professional supports can come in, the social supports can come in. So even if there's an individual out there who's listening in today who's on their own, there are supports. And often, if you are pregnant, you are linked in already with medical care. And when there's in Australia, at least, when there's been, a miscarriage, hospitals are very good at linking you in with that social work or counselling support initially, until you can then move on and think about, well, what do I need to see a psychologist for a longer period of time? Do I need to connect, or do I have the supports that I need? Am I working through things?
Absolutely. And before I move on, we have Saleh mentioning great advice. Wish someone told me about this when we were young. Thank you, Saleh, for watching, and thank you for your comment. And thank you to the ladies also, because this has been a very, very important conversation so far. But before I kind of wrap up, one thing that I want to know from both of you is, in your own experiences, do you think that miscarriage is prevalent in a certain ethnicity more than others, or it's very random? Beulah, I'll start with you first, then I'll come to you, Swaroopini.
I've seen it in lots of different cultural groups, but I think to the way people recover from miscarriages can differ among cultural groups. I think within our culture, South Asian, Southeast Asian, we tend to not talk so much
Yeah.
about the emotional parts. And that can make it more challenging to actually identify what's going on, to be able to work through some of that. So we often, push things under the carpet, just keep moving on, keep going on, don't talk about it. And that's actually going to prolong and make things worse in the longer term. So I think as a community, if we can start to normalize thinking and talking about our mental health and articulating emotions, and for that not to be a sign of failure, but actually a way of owning our experience, acknowledging the authentic self, and to be able to then connect in that way with one another. I think those are really important things.
Yeah. Swaroopini, in your experience, do you reckon that, we have a comment from Daniel Smith. Do you offer just advice and help? Should I contact? I think this was for you, Beulah, I don't know. So, Daniel, of course, you can contact both Dr. Thangarajah and Dr. Joseph. Their contact details are mentioned in the chat. Feel free to ping them or message them. They'll be more than happy to help. And thank you for watching. Swaroopini, in your experience, do you think miscarriages are more prevalent in a certain sect, or they're just about random?
I think that they are still having that random nature. With the South Asians and the Southeast Asians, we do have more medical conditions that are prevalent. So things like type 2 diabetes, being overweight, high blood pressure, and heart disease in families as well. So these things are slightly more common in certain families. But then we also see that so those things have some significance as well, and that's why we say that if you can for the next time before trying for a child, if you can see the medical practitioners, we might be able to potentially optimize certain conditions to give you as best a chance as we can. And sometimes, no matter whatever you do, whatever the doctors do, we still cannot prevent that 1 in 5 baseline rate, because it is just so common. As I said, like even what we think is the most perfect medical specimen, which is very difficult to obviously have anyway, they still have miscarriages too. So it, that is not there. But in saying that, I do work in a very high risk maternity hospital in Melbourne, and we do extra monitoring for South Asian women when they're pregnant, because there are certain changes that increase potential stillbirth rates after a certain number of weeks of pregnancy. So we do some extra monitoring because we are aware of risks of things that happen back home in our countries, which we generally avoid because we already know about that in our countries. But it's not often translated to the Australian system. So there's a few hospitals that have started to take our research on board. And, I do a lot of education to the women, and the more women that I tell that we do this monitoring, then they pass it on to their friends, and then it will just spread to our community, and we'll all make sure we get all the monitoring that is as optimal as we can during the pregnancy as well. So even if there are pregnant women, I'm sure, that are probably listening to this too, make sure you have a chat to your doctor about this as well, because certain hospitals do some extra monitoring too. So I think we do know some certain ethnicities have some pregnancy-related risk too. So that's where the medical professionals can help with that too.
Absolutely. And this conversation cannot specifically end somewhere, but I think tonight we have to draw the line somewhere. But before we draw the line, Daniel says, I tried but won't show page. Do you want my email? Of course, Daniel, drop in your email ID, and the doctors will get in touch with you when they have a good time. Thank you. All right, before I wrap up the conversation, Dr. Beulah and Dr. Swaroopini, what would be your message to our listeners or to someone who's going through a difficult phase? Swaroopini, I'll start with you, and then Beulah will wrap up with your message.
Yes, I think my main message is that you are not alone. There are so many supports available, and please seek help. And if you don't know where to turn, please feel free to email through my website or see your general practitioner or your medical specialist, because there'll always be someone that can point you in the right direction. And we are going to send you some mental health links as well, which I think we've done already as well. So there's some great organisations in place. Some of these are Australian-based, but some of the information sheets that we've provided are actually for, they can be accessed on the internet. So they're from our top hospitals in Victoria, in Melbourne, and they have very good guidelines and very good information. And you can, use that in any country that you're listening to us in to get some supports as well. So I think it's important to know that you're not alone, and to be aware that it is unfortunately a common occurrence, and to be honest, it would be the most traumatic thing that someone has to go through. So I think to acknowledge that and to seek help is very important, because it does shape the rest of your life, whether or not you do choose or not choose, or you can or cannot have children in the future. It will always stay with you when something like this happens. So make sure that you try and optimize by seeing a professional to help guide you through that journey, because as Dr. Beulah said, there's no end point like that. It will be, on this day you're going to feel absolutely 100% back to normal life. and it may never get back to normal life for some women. And that's where, you know, we need to really link in with the professionals to really go through with you to give you the best care that you can have, and to also take some of that burden off your shoulders, because that's what we're there for.
Awesome. Thank you, Swaroopini. Moving on to Beulah, what would be your message to our listeners?
I think, you know, particularly with the clients that I've worked with who've gone through this experience, you know, there's a lot of should. I should be able to deal with this. I should have gotten over this. I should have recovered. I should be able to cook dinner for the whole family. I should be able to do this. The reality is miscarriages are tragic, horrible experiences. And it's actually okay not to be okay for a little bit. I would be more concerned if someone's gone through this and said that they were fine. It is normal not to be fine when you've gone through something like this, and it can take some time to recover and to heal. You know, and I second the message in terms of getting the right supports. People often are unsure or uncertain about seeing a psychologist. We're not that scary. You know, I might be scary to my kids sometimes when the chores aren't done, but you know, psychologists, we're people too, and we do the work that we do because we want to help and support. So, you know, if you feel that having a separate space and speaking to someone who works in mental health would be helpful, you know, I do urge you to reach out, because it's a much better way of healing and recovering than pushing things away.
Yeah.
And we're here to help.
Absolutely. On that note, to both of you, thank you so much for spending our time with me, spending your insight and your experience with us tonight, because each word that you both spoke were very, very valuable and insightful for anyone who's going through. I think nobody should have to go through, but if anyone has, they will have a lot to gain from what both of you discussed. So again, for all our listeners and audience, if you have any questions for either of our doctors, all their contact details are mentioned in the chats below. Feel free to get in touch with them. They will be more than happy to help you with any questions that you have. On that note, we will wish you a very good night. Stay safe. We have one question pop up. I'll quickly show that up. So Maha questions, how many miscarriages are considered normal for women? Swaroopini, would you like to quickly take it up?
Yes, so generally, if women have had 3 miscarriages, we do further investigations. So that can involve sometimes genetic testing, certain types of specific blood tests to look for certain causes. So sometimes some clotting factors we look into, and different blood disorders as well. So I think if any woman has had, even if you've had 2, I think you can still seek medical help to get some assistance to see if some tests are warranted. And then if you've had 3, to please seek medical help, because some things are potentially treatable or manageable to be optimized for the next time as well. So I think if you're having recurrent miscarriages, please seek medical help as well. So that can be with the obstetricians or the gynecologists as well.
Thank you. Beulah, do you have anything to add in there quickly?
I think aside from what's already been said, if you're unsure, ask. So if there's anything you're not sure about, you're not quite comfortable with, you know, I urge you to reach out and just have a conversation with your medical professional. It's better to ask and for them to say, no, it's okay, than not to ask. And that just adds another layer of worry.
So Maha, thanks both of you for your reply, and a big thanks to you, Maha, for watching us tonight. So on that note, thank you everyone for watching us, for hearing us, for putting in your comments and spending time with us and our doctors. We wish you staying safe, because these are difficult times. We have COVID, sometimes there's a war. Stay safe and keep loving the people around you. We need humanity more than ever. And to both of my guests, thank you so much. Have a great night. I will speak to you some other time. Thank you so much.
Thank you.